obstruction externally over the nose and the mouth, then that is either gagging or smoothing, that is plastic bag smoothing, or smoothing by some soft material or by hands itself. Okay, that is known as smoothing. Smoothing, and especially if cloth or something is pushed inside the mouth, then that is known as gagging. So it's better you remember this picture. Okay, so start from the external orifice. It's my gagging ayo, smoothing ayo, plastic bag smoothing ayo. Okay, and then go a little bit inside. Okay, if there is some obstruction out here by food or any other foreign object, then that is known as choking. And if there is compression over the, yes, Kiboyo?
Picture they has on, ma'am.
Pictures as
No, ma'am.
Okay, wait. Kailan ayo?
Ayo, ma'am.
Okay. So you can see this picture, So again, I'm repeating. If you are asked about mechanical asphyxia classification, then remember this picture, remember a person out here. Okay, so start from the external orifices. If there is obstruction over the nose and mouth by smoothing, you can use hands or some material is used, your pillow is used, or if there is some kind of plastic bag around the head, okay, that can cause suffocation. That is also known as plastic bag smoothing. Okay, that obstructs the nasal passage and mouth. And then you go a little bit inside. If something is stuffed inside the mouth, that is known as gagging. That again causes obstruction in the airway. Asphyxia भनेको नै, if there is any interference in respiratory passage by some kind of obstruction, then that causes asphyxia. So obstruction in the airway passage by some material is known as gagging. Okay, and when you go inside, if there is any kind of obstruction by foreign body or food or anything, then that causes choking. And go a little downwards again. If there is any kind of ligature material around the neck, which can be either by hanging or by strangulation, then that also causes asphyxia, hanging or strangulation ayo. And then further, if there is any kind of trauma over the chest, this causes traumatic asphyxia. All right. So if there is compression over the chest, then that is known as traumatic asphyxia. So यति हेर्दाखेरि नै धेरैवटा कभर भइसक्यो हुन्छ. अब त्यो बाहेक we have drowning. If there is presence of fluid in the air passage, drowning. Okay, and other causes are can be pathological or toxic substances, so especially due to asphyxiant gases like carbon monoxide, hydrogen cyanide, and potassium cyanide. Environmental asphyxia, again, very important. If there is less oxygen in the atmosphere or in the enclosed, if a person is in the enclosed place or in higher altitude, then that causes environmental asphyxia. Traumatic can be either if there is any kind of trauma from external trauma, traumatic asphyxia also, or if there is any pathological changes such as pulmonary embolism or fat embolism, then that also causes traumatic asphyxia. Very important one is postural asphyxia. This is usually common in alcoholics or if person is having substance abuse or disease. You have seen few pictures on postural asphyxia where a person is compromised to breathe properly due to their position in a different various position. That is known as postural asphyxia. or iatrogenic. These are the pictures of postural positional asphyxia. I'll be moving on fast. But you have to know about this pathophysiology of asphyxia. Please go through this slide. Asphyxia stigmata भनेर हाम्रो तीनटा signs हुन्छ, cyanosis, congestion, र petechial hemorrhages are the most important signs of asphyxia, which is present in all kind of asphyxia. But the amount or severity depends upon the how violent the asphyxia was. Especially, this is more prominent in strangulation and throttling than other types of asphyxia. Okay, so hanging भनेको के हो? You have to know types of hanging, causes of death in hanging भनेको mechanism of hanging. Hanging मा पनि अब you have different types, different causes of death. So it depends upon various things like what was the type of hanging, or हाम्रो अब complete hanging थियो कि partial hanging थियो, what was the type of the ligature material used, हैन? त्यसमा चाहिँ we have different causes or mechanism of death. So these are the different mechanism that, again, very important. Delayed death हुन सक्छ, even if a person survives some period of time, may die due to these various causes. Okay, and external examination ma कसरी examine गर्ने, it's same for all kind of death. Okay, but again, hanging ma के मा specify गर्नुपर्छ, हेर्नु पर्यो. We have to examine even the ligature about how, when it is removed, how it is removed, I know what was the type of the knot, why we should be knowing the type of the knot. These are the few important questions. Please go through that. And you have to describe the ligature material and mark as well. I know कस्तो type of mark थियो, furrow थियो कि grooves थियो कि V-shaped को थियो कि, and it depends upon the knot, presence of knot. If there is a running noose, then it can be horizontal. Otherwise, V-shaped knot, V-shaped ligature mark हुन सक्छ. This is V-shaped mark. So wherever the knot is, you can see the oblique. Yes.
Slide नै change भइरहेको छैन अघिदेखि नै.
हो र? What's wrong?
Mechanical asphyxia मै छ slide त.
के भयो त? एकछिन, I'll stop share and then again share. अहिले आयो? चेन्ज भयो?
Mechanical asphyxia मै छ.
Mechanical asphyxia मै छ.
Yes. We will join back again. I'll just redo this.